Good evenings and greetings to everybody. Welcome to Head to Toe with Dr. T. It's another lovely evening at Mpumakapa TV. Thank you for joining us. Today we are sitting on the nose job. And we've got none other than the best when it comes to nose jobs. And he's going to introduce himself and it's going to be a very interesting evening. Thank you for joining us. The nostrils, the nose and everything around it through the eyes and ears and the brain of a specialist in that field. I'm always interesting. That is why I want everyone to be able to smell something. Doc, thank you so much for honoring our invite and can you kindly greet our viewers?
Hello everybody, it's a huge honor for me to be here. We've known each other for many years and now finally I get to be on the show, so thank you. And I hope you guys are going to find it very interesting. My name is Cameron, which is a Gaelic name for crooked nose. So my parents must have known I was going to be a nose surgeon by calling me crooked nose. But my nose is okay.
So Cameroon means crooked nose?
Crooked nose, eh?
Okay, so hence you are sorting
every nose, eh?
Macintosh.
Yes.
Briefly, there are a number of people who are watching us. Some of them are interested in medicine, some of them are interested in specializing and so on. And you went into otorhinolaryngology,
yes,
which is ENT in simple terms. Some people don't even know what that is. Can someone be a doctor and then just focus on the nose and so on? Can you just take us through your route as well? How did you get
your
I'd
love to. Eh? So I was born in Mgungundlovu in Pietermaritzburg. I grew up on the farm there. So my nickname was Gobondela and I learned to speak isiZulu. Did it from a trick to read and write, and now I'm staying with the Xhosas here in Epai. Yeah, so I took quite a long route. I ended up going to Stellenbosch University, and I was studying medicine, but at the same time I was doing professional sports. So I used to do a lot of canoeing, and I would study for a few years, then I'd go overseas and study and come back. And one of the things professional sports taught me is discipline. And eventually, at the end of the Beijing Olympic Games is when I stopped paddling, and then I went to go and specialize. And it was quite a long journey for me to finally, I had an amazing meeting with I was doing GP work, and I wasn't quite sure what I wanted to do. I had kind of some interest in plastic surgery. And so I was on a GP refresher course, and I saw the professor of ENT, or ear, nose, and throat. Amadlebe, Mpumlo, Nomqoqo. And this guy, we had this amazing coffee. I never thought about it. When I got home that evening, I realized that my quiet time, I'd been reading about Jesus healing the deaf mute in Mark chapter 7. And I was like, this is a sign. So I wrote my first set of exams and I failed. And I said to the prof, no, I failed. He says, don't worry, everyone fails. You have to try again. And then eventually I tried again and I passed and I ended up going to Bloemfontein. In Iguasutu, I had that Kiteng Lekai, I knew none of the language. But I had amazing 4 years in Bloemfontein to learn to do ear, nose, and throat specializing. And then initially I thought I would go and do a postdoc or a PhD abroad. But whilst I was studying, I then had my eyes open to what's called facial plastic surgery. Now, in South Africa, it didn't exist. But in Europe and in America, if you go for any plastic surgery from the neck up, be that reconstructive surgery, be that cancer, be that rhinoplasty, be that what we call the aging face. So facelifts, brow lifts, ear issues.
Yeah, we've got to be good looking ancestors.
Yeah, but all of that is done by a facial plastic surgeon. And to become a facial plastic surgeon, you have to you have to be completely specialized. Then you spend 2 years and you write exams. So that's what I did. I ended up writing these exams in Washington and coming back to South Africa as the only facial plastic trained guy in our continent, which is amazing. And then we started a fellowship program. And we, at the moment, actually one of our colleagues, Zanele Tuswa from Umtata, is doing this 1 year facial plastic fellowship. And then she writes the exams. So within this world of facial plastics, where I found my niche was in rhinoplasty. And the wonderful thing about studying ENT for so many years, you know the function of the nose, but doing the facial plastics, you know the cosmetics. So these two come together amazingly. So yeah, I now live in Port Elizabeth. We built this beautiful hospital called Edge Day Hospital, which is really built for rhinoplasty. But I've got a lot of other colleagues who work there as well. And I just love doing nose jobs. I'm a nose job geek. And yeah.
So ENT has got the throat part, has got the ear part. You only focusing on the nose.
Yeah, so it's a very interesting speciality. It's actually the first speciality that ever became a speciality. And you would imagine, as a GP, I would hazard a guess that a third of the patients who see you is an ENT-related problem. Oh, doc, my sinuses
That's
are killing
true.
me. My
throat.
my throat or my ears. It's such a common thing. So we as ENTs see many things, but I've kind of migrated away from ear surgery and throat surgery to more sinus surgery and especially rhinoplasty. And the rhinoplasty is this thing about how does it work and how does it look. So there's both cosmetic. Someone who comes in with a very big hump or a skew nose, we got to fix that and we change what they look like at the same time. And it is so satisfying to do that and to literally change people's lives.
So you are dealing with symptom relief at the same time you are dealing with the image.
100%, 100%. And what I'm always trying to teach is that we need to understand a obstructed nose or blocked nose is either what we call a mucosal and a medical treatment.
Yeah.
So you might have severe allergic rhinitis or you might have sinusitis and you manage them with various medications and the patient will be better. If a blocked nose does not improve on this, it's mostly a structural issue. So that might be that there is the septum has grown skew or you might have a big spur in the nose. And you can give that patient intranasal steroids or it's not going to do anything. You have to cut.
Temporary solution.
Time to sigaga. And then it's the opportunity to potentially change what it looks like at the same time. Some people don't want to. Some people do. And then also there's obviously this other space where people have no functional problems whatsoever. Their nose is perfectly working, but they hate what it looks like. And that's a different thing because now the medical insurance isn't paying for the operation. Now they must cork out themselves for that. Yeah.
Tell me, what kind of common problems do you see that you've corrected so far?
Okay, so in the mucosal problems, we see a lot of allergic rhinitis. And I mean, I'm sure you know here in Gqeberha, it's one of the pollen capitals of our country. So we have to deal with that with the medications to bring down the amount of swelling inside the nose. We also see a lot of sinus problems.
Okay.
But now remember, when a patient comes to us and say, oh, my sinuses are killing me, people don't distinguish what's the difference between the nasal passage and the paranasal sinuses. So the nasal passage is normally a rhinitis, kind of an allergy, whereas the sinusitis is an infection. And that we treat with antibiotics, and sometimes we have to do surgery to drain the pus out the sinuses, etc. So we see allergic rhinitis very often.
Okay.
We see sinusitis less often, but it happens. I'm talking only about the nose areas.
Yes.
And then, we see a lot of sports injuries,
Yes.
The rugby players, the boxers,
Before we get to the sport injuries, I'm going to hold you there. We're going to take a short break because I've seen quite a few rugby players twisting their nose right next to the field.
Yes.
Then I would like to have your opinion on that. And then what else do you do to actually make sure that that thing is correct? Because really, I was very, very much keen to hear about the sports injuries. Have we messed up or have we done the correct thing by what we're doing next to the field of play? Thank you for being with us. We're talking to Dr. Cameron McIntosh, who is our otorhinolaryngologist. He's an ENT specialist who is more focused on the nose. Rhinoplasty is fixing the nose for symptom relief and also for your image. Thank you for being with us. Welcome back to Head to Toe with Dr. T. Thank you for being with us. We are with a guru, a rhinoplasty surgeon, someone who deals with the nose jobs. there's nose jobs, rhinoplasty. And he's taken us through the common ailments that he deals with at specialist level. People with allergic rhinitis, we've got very congested noses, and people with sinus problems. They deal with such issues for symptom relief and also for cosmetic corrections and also for all other things that he's going to talk us about. Sports injuries.
Yes.
we're told in sports when people are playing rugby or boxing and whatever, if they get hit in the nose and then the nose deviates, we should immediately fix the fracture. Are we doing the right thing? Do you get a lot of those things, and what do you do?
No, absolutely. So I think it's a topic I really enjoy very much because I had a background in sports as well.
Yes.
So on the fields are obviously most important. And for the medical professionals who are listening to this, we remember we have to do the ATLS guidelines. So make sure that you don't just run in there and start bending the nose when the patient's going to lose their airway or they've got a cervical injury or something like that. But we definitely trying to, as quickly as we can, reduce the fractures. The most important thing we must look at after that is there a septal hematoma? Because if the septal hematoma is not drained, we can get a saddle nose deformity from when the cartilage all falls down. And also what I found so interesting is how many people still do X-rays for a nasal fracture. We have to do cone beam CT because the CT gives us that 3D look. We can do so much more through that. So in terms of sports injuries, the ABCs, obviously, ATLS principles, make sure you reduce it as quickly as you can. Make sure there's not a septal hematoma and get a scan. And make that guy, it's your opportunity to make him look good. However, I must say, when somebody has an injury and they come to see me immediately and then they request a cosmetic rhinoplasty at the same time, then a red light flashes. Because that's not the time to do a cosmetic rhinoplasty.
Okay.
It would be the time to just fix everything and then at least 6 months later consider doing a rhinoplasty. Yeah.
Why can't you do it at the same time?
Because of the trauma that's been caused at the time. We did a whole publication on sports injuries. There's a variety from a soccer ball to a surfboard, where a surfboard's actually trauma. It can cut the whole nose open. So as soon as there's any external injury, any laceration, we should not be doing a cosmetic work at the same time.
Is it easy for the cartilage to regenerate, or you're making plans, or you're putting prosthesis, whatever?
Yeah, so we got to be, especially with children. So injuries in children, which is also a thing that I don't agree with, is it's taught that wait until the child's older before you even do anything, and that's really actually dangerous because so then a kid will break their nose when they're 2 or 3 years old, and then for 15 years they can't breathe through their nose properly, and their nose grows skew. Whereas if we can early get in there and prepare and repair as minimal as we can help that child to grow into their nose as they get older. Yeah. And then I thought, what would be interesting is people always want to know about rhinoplasty. So it's like, what about the before stuff? How do we actually do the operation? What about the after stuff? So I think a few things for the people who are listening there and considering rhinoplasty, etc., is do your research. It's a big operation to have. It's in the middle of your face. It's sub-millimeters that we see difference. It's not like getting a boob job.
Yes.
If it's a little bit different, it's not the end of the world. Or a facelift that can be out by a few millimeters. On a nose, it's very difficult. So firstly, be very sure about it. I probably only operate on about 70% of the people who come and ask for operations because it's, in many ways, it's psychological surgery. And there's problems and issues that a nose job isn't going to fix in their lives. Like having a nose job isn't going to, you're suddenly going to find the love of your life, or the divorce isn't going to happen.
It's like a cosmetic thing.
Yeah, so you've got to be very cautious about it. I think it's also important that the relationship with a surgeon, because just like I have to trust you, the patient has to trust me at the same time. And if there's any feeling of like, this is not looking good, find another surgeon, get another opinion. There's some really great surgeons in our country. We've got our organization called SARSA. It's the South African Rhinoplasty Society. So if you go on a guy's website and you see the SARSA logo, you know that guy's coming for training and learning, etc. So I think in the things I'm trying to say to people is think about it carefully. Look at the kind of nose. Remember, what might look nice on Mqintosha's face over here is not going to look nice on Tebelele's face. So we've got to understand that there's different ethnicities in it. So I think those are the key things in terms of the preparation.
There are people who want a sharp nose, there are people who want a blunt nose, and so on. You work on all those things.
Yeah, so how it works with us in the practice is once a person comes for the interview and we've had a look at everything, we've done a CT scan, we've got 3D photographs. So we will, what we call morph the images, so change them around and make the nose flat or turn or whatever. And it's great to see. But remember, you can always overpromise and underdeliver. So that's crucial. So I think those are the key things in terms of preparing. And then in the actual operation, so this is what is very interesting. So there are two kind of ways to do the operation. The one is called an open approach. So you make a little cut under the nose and you literally lift the whole nose off the face. And you fix what you need to do and you put it back. The other way is an endonasal approach. So the cuts are all inside the nose and you work with cameras. So there's different reasons for doing an endonasal and an external approach. But then the other type of surgery that we have within the space is what they call structural and preservation surgery.
Okay.
And if you've got somebody with a big hump on their nose, now it's not common in the black population, but it's much more common in like the Asian population or Middle Eastern.
Okay.
Now, in the past, what we used to do is lift the skin up and cut the bone off, and the nose looks great. What we now do is this preservation technique where we do all the cuts inside the nose and the facial bones, and you just drop the nose into the face. And it's amazing to see some of those results. There's obviously also complications, things can happen, but that's
what kind of complications are you commonly getting or
so
likely to get?
we would always consent patients is bleeding and infection are the two early complications. So we've got to be very cautious how we manage that. People say, oh, it's so sore, you're going to cut my nose. Surprisingly, 1 out of 20 patients actually takes painkillers. It's soft tissue. It's discomfort, but not pain, because pain is often associated with an infection. So the two most common things we consent patients for is bleeding and infection. And then once everything has settled down, within the cosmetic world, about 1 in 12, 1 in 13 patients aren't quite happy. Oh, doc, my nose tip isn't tight enough, or oh, you left still too much on top of the bridge. And those are touch-ups. They're not botched operations.
Okay.
They're touch-ups.
Let's hold it there on the touch-ups. And then before we do the final touch-ups, we're going to take a sip of water and then we'll be back shortly. Thank you very much for being with us. We are with Dr. Cameron McIntosh, the principal and chief marathon runner at Edge Hospital, is an otorhinolaryngologist. That is an ENT specialist who's focusing more on the nose job, rhinoplasty. That is what we're talking about. Sports injuries, chronic sinusitis, allergic rhinitis, all those issues that are making you not to breathe well. That is where we are. Thank you. And then we'll see you in the next few minutes. Stay with us. Welcome back and thank you for joining us on Mpumakapa TV, your favorite channel, channel 260, good DSTV. And also thank you for watching us at Free Vision Play. Don't forget to always follow us on TikTok, Mpumakapa TV, Apile Communications, Facebook, Mpumakapa TV, Apile Communications, Instagram, Mpumakapa TV, Apile Communications, Twitter, Mpumakapa TV, Apile Communications, where we always update you who's going to be with us. Like tonight, we've got Dr. Cameron McIntosh, our otorhinolaryngologist, is taking us through nose job. That is rhinoplasty, nose job. What else do you have for us?
Let's talk about botched nose
journey.
jobs, eh?
Yes, botched nose jobs.
Yeah.
When
Paul
things
Massive.
don't go as planned.
Exactly. And the guys love watching Paul. And I've had some lovely interviews with him on my own podcast. So what I found in my career as I've progressed by doing more and more rhinoplasties is what we call, there's a difference between a primary rhinoplasty, so someone who's never had a rhinoplasty before, and then a revision rhinoplasty. So someone who has to come for another operation. And those operations are quite clearly defined, like in two areas. Either little touch-ups, small, maybe like the alar cartilages weren't made small enough.
Okay.
So it's a smaller procedure, or you're sitting with a botched nose. And that's always a very sad situation because most of the time the cartilage has been used up in the nose. So we generally, as the artists within the rhinoplasty, we use the cartilage of the patient to change shapes of the nose.
Okay.
But when that's been used up, then you have a problem. So you need to find other cartilage. And we have a few sources. So either you're going to take some cartilage from the ear, and you can use that cartilage to build up the nose, or you're going to take a piece of rib, and that can be as big as your finger, and use that to build up the nose. And then sometimes there's even donor cartilage, so that you get from the tissue bank.
Okay.
And those operations normally take twice as long as a normal nose job, and you don't always have the same outcomes. So yeah, it's challenging. It's an amazing operation because they call it the queen of plastic surgery operations, because you're dealing in 3D. You know, if I lift the tip of the nose up like this, I've already changed what we call the nasolabial angle. And then from a 3/4 view, it doesn't look quite the same. So it's constantly, when we're operating, we're moving around the patient the whole time to look at the patient from all different views.
Okay.
And then the problem is selfies, because people have the selfie and that camera's close to them and change their face shape. And we've got to say to people, guys, that's not what you look like, you know? and social media is pushing this whole thing. Like, like I'm very busy on Instagram, and I run my own YouTube channel and stuff for one purpose: education.
Yes, that's very good.
Because there's so much fake stuff out there. So last year, we actually hosted the World Rhinoplasty meeting right here in Port Elizabeth. And what the background was to that is, during the COVID lockdown, I ran a whole lot of very interesting webinars with the international speakers, etc., and thousands of guys listening. But the big American plastic surgeon, Rod Roerick, who's taught me so much, he used to always say to me, he said, "Hey, Cameron, everyone's world famous on their own website." And I thought, yes, let's do an Olympic Games of rhinoplasty. So at the 2020 year and then 2024, and it will be again 2028, we had the World Rhinoplasty Day. And we arranged this webinar that we broadcast live from Edge, where we divided the world. There were 72 countries. So each country had 18 minutes to do a presentation. Then we came into the studio, and then we went to the next country. And this started in Japan, and it ended 24 hours later in the United States. And the judges of this competition were the editors of the biggest journals in the world. So I gave the boys the platform. I said, okay, you want to preach? Let's have a preach-off. Show us how good you are at what you can say and teach. And it was amazing. And then after this 24-hour extravaganza, we had 6 surgeons that I'd invited from each of the 6 continents to operate on a patient representative of that continent. So the guy from Asia operated on a Chinese lady, for example. And once we'd finished those 2 full days of operating, we had some liquid rhinoplasty, because that's a whole topic in itself. It's fillers in the nose. And we've got to be super, super cautious about fillers. And especially in the, I'm assuming the population mostly watching this is the black population.
Yes.
Is you normally want a better defined dorsum of the nose. And what do you want to go for? Filler. But as you know, fillers can be super dangerous. You can go blind from them. You can get necrosis, because if it gets into the artery, there's no blood flow to the skin of the nose. So yeah, that was what we had last year, and it was an amazing experience.
Well done. I did get visuals of that, and then we shall get and catch some of those in your social media. Thank you very much for honoring our invite. The enemy is time. I'm sure I'm going to have you next time. Our viewers, thank you for watching us. See you next week at Mpuma Kapa TV, channel 260. Head to toe, your favorite show. Thank you so much, Dr. McIntosh. Looking forward to having you next time.
Thank you.